Hi, I'm Sunil Solomon. I think over the past year, what we've realized is many people turn to unreliable sources for medical advice such as WhatsApp, Google, and Wikipedia. But I'm here today to tell you how to live a safe Zindagi. Over the past 2 years, I think our lives have really been taken over by HIV and COVID. So people always ask me, what is the one thing that COVID has taught you about the HIV epidemic? And I think for me, what it really did was it accentuated the people component of people living with HIV. I think we really need to remember that people living with HIV are people first, and then the HIV comes on, and they have requirements during the COVID pandemic that all of us had. Going forward, we really should be considering holistic approaches to health, where we not only take care of the disease, but we take care of the individual as a whole, and that is something the COVID pandemic really has accentuated for me. I think that's a very good question. So one thing to remember is the COVID pandemic is only about 2 years old, so we don't have enough data to make conclusive statements. But I think what is important is that at the recent AIDS conference, WHO presented data from over 100,000 patients who were hospitalized from across 24 countries in the world. And what they found was people living with HIV had a 13% higher likelihood of having severe disease. They also had a 30% higher risk of mortality if they were admitted. And among people living with HIV, I think the other thing to remember is people over the age of 65, people with diabetes, people with hypertension, that risk is further elevated. And in terms of the HIV disease itself, the strongest predictor of adverse outcomes to COVID in people living with HIV is your CD4 count. The lower the CD4 count, which means like your immune status is functioning poorer, the higher your risk of an adverse event related to COVID. So now that we know that people living with HIV are at a higher risk of severe COVID and mortality from COVID, a question I get very frequently asked is, I am HIV infected, what can I do to protect myself from COVID? So the answer is very simple. People living with HIV are also people, so the same strategies that work for people who are not living with HIV work for people living with HIV. So 1, always wear a mask. 2, limit going out. 3, if you must go out, practice social distancing to the extent possible. 4, hand hygiene, always wash your hands with soap and water when you go out and when you come back in. And 5, and probably the most important, is vaccination. Vaccine is the only thing we have right now to protect ourselves from COVID. So if you get an opportunity, please go get a vaccine. There is nothing to suggest that people living with HIV have bad outcomes from vaccines. So if you have the ability to get a vaccine, please go get a vaccine. But remember, you're not alone. If you have an issue, you have a question, reach out. And reach out to a qualified health professional, whether it's a nurse or a counselor or a doctor. Misinformation really has been one of our biggest challenges in overcoming the COVID pandemic. So if you have a question, ask us. And until I see you again, live a safe Zindagi, because your life is in your hands.